Good afternoon, Professor. Good afternoon, class. My name is Dr. Tana Patricia Luque Machado. Present is viruses and the risk of lung cancer prevention and treatment. Next, please. Introduction. Smoking is the main risk factor for lung cancer. Other factors include exposure to asbestos, household use of biomass fuel, environmental pollution, genetic factor, and chronic diseases. Infection risk factors such as pneumonia have also been described. Recent reports suggest that viruses such as HPV, Epstein-Barr virus, and measles virus may play a role with lung cancer. It is important to note that the recent COVID-19 pandemic has shown that cancer patients are at high risk of SARS-CoV-2 infection, with an increased risk of complication and death, particularly in lung cancer patients. Next, please. Lung cancer in Europe. In 2020, it was estimated that a total of 327,000 new cases of lung cancer were diagnosed in 27 countries in the European Union. Overall, 64% of cases were diagnosed in men and 36% in women. People ages 45 to 69 have the highest number of new cases reported, a total of 257,293 people died from lung cancer in 2020, of which 66% were men and 34% women. Lung cancer is the leading cause of cancer death in men and the second in women, both in Europe and worldwide. Viruses and their relationship with lung cancer. Data from the Global Database of the International Agency for Research on Cancer provide incidence and mortality rate for 36 types of cancer and includes data from 185 countries, which reported an estimated of 2 million cancer attributable to infection worldwide. The main infectious agents associated with cancer were Helicobacter pylori, human papillomavirus, hepatitis B virus, and hepatitis C virus. Tobacco smoke alters the immune response, contributing to viral pathogenesis and causing deterioration in lung function. Next, please. Human papillomavirus, HPV. It is a double-stranded DNA virus associated with the development of several types of neoplasms in humans. Today, more than 200 types of HPV have been described, of which type 16 and 18 are responsible for 70% of HPV-related cancer. A review of 78 studies with data from 93 85 patients screened for the presence of HPV infection in lung cancer. A possible role of HPV transmission in the oropharyngeal and hematogenous airway. Additionally, some reports show that non-smoking women with HPV infection have an increased risk of adenocarcinoma. Epstein-Barr virus is associated with a particular subtype of primary lung cancer called lymphoepithelioma like lung carcinoma, which most frequently affect young non-smokers. Current data suggests that Epstein-Barr latency may facilitate the progression of chronic lung disease to lung cancer. Human immunodeficiency virus, HEV. People living with HEV have a higher risk of developing lung cancer than the general population. In a French cohort study that analyzed data from people living with HIV demonstrated the increased risk of lung cancer. A large study carried out in the US of people living with HIV during the period 7, no, 1977 to 2002 found that lung infection was associated with an increased risk of developing lung cancer 10 years after the onset of SIDA. Next, please. GSRD causes lung cancer in sheep cow or by pulmonary adenocarcinoma, a disease that can be transmitted between animals by aerosol through coughing or sneezing. It is characterized by chronic respiratory signs, the transformation of alveolar disorders and bronchial tissue that can give rise to a tumor that can potentially affect large areas of the lung. Prevention and treatment of oncogenic viruses. Prevention of infection by oncogenic viruses is complicated since with the exception of HPV, there are no approved vaccines for the viral agents described in the previous section. Once the viral infection is detected, there are some strategies to avoid viral activation and blood or reduce oncogenic transformation. Currently, there are several clinical trials evaluating drug or vaccines against EVV. Conclusion. The role of viruses in the development of lung cancer remains unclear. Although basic research studies have demonstrated possible oncogenic mechanisms of viruses in lung cancer cell lines, more research needed. Tobacco smoking may contribute to oncogenic and increased viral pathogenesis. Next, please. Now for your attention.